Very good afternoon to you, ladies and gentlemen, members of the media gathered here with us, and those of you who are joining us at home and elsewhere on your various platforms in radio and television. Welcome to our update, our weekend broadcast. Today is one of those days where we look at where we've been, where we are, and what the weeks and months ahead are projected to be. The last time I spoke with you was 2 weeks ago, and we said we were evaluating the responses from the national population, and the doctors were giving us the data as to how we were proceeding. In the meantime, I think it's becoming more and more convincing that we, along with the rest of the world, are having to come to grips with the reality that we're hoping would not have been the state of play, that we are having to live with the coronavirus. The virus is appearing not to want to leave us in any short or medium term, and as a result of that, we are having to do what has to be done, cognizant of the fact that the virus is with us. And some of those things you are familiar with by now because they've been our daily exhortations, and they still remain in place. Today, I would like to begin by asking Dr. Parasham and his team to give us the scientific appreciation, and after that, we would see where we are in terms of response.
Thank you, Honorable Prime Minister, ministers, members of the media, members of the viewing and listening public. So I'll begin with the clinical update for October 10th. As of 2 p.m. today. So total number of tests, unique patient tests, 30,423. The total recovered patients, 3,221. Total active positive cases, 1,726. Number of deaths now stand at 90. New positives reported over the last 24 hours are 22. Total positive cases for COVID-19 now are at 5,043. Total hospital patients, 116. Total patients at step-down facilities, 38. At quarantine facilities, 100. And in home isolation, 1,570. So looking a little closely at the hospital numbers, we have at the hospital system 118. At the Couva Hospital and Multi-Training Facility, we have 61. 5 in ICU, 4 in HDU. Cora, we have 30 persons. Arima General Hospital, 3. All of them in ICU. Augustus Long, there are no persons at this time. St. Anne's Hospital doesn't have any individuals either. At the Scarborough Regional Hospital at Fort George, there are 21. And at Signal Hill, there are no persons at this time. In terms of our step-down facilities, we have at the Claxton Bay Correctional Facility, 27 persons. At the UE Day Hall, 11 individuals. In terms of quarantine now, we have 100, as I said before, and they are spread between 4 facilities. The Cascadia Hotel, there are 10 persons. Regent Star, 32. Paria Suites, 56. And Davy Halls, 2. If you would permit me 1 minute, Prime Minister, just to go into, because today is World Mental Health Day. So just briefly, before I hand over to Dr. Hines, I just want, along with the rest of the world, to commemorate World Mental Health Day, which is celebrated on the 10th of October each year. In Trinidad, what we celebrated was a Wellness Week, National Behavioral Health Week, which was run between the 5th and the 10th of October this year. And its theme was Mental Health for All, Greater Investment, Greater Access. So we understand the definition of health is defined as a state of complete mental, physical, and social well-being, not just the absence of disease. And in this time of COVID in particular, where we find that physical restriction from our peers, from our loved ones, fear of infection, dying, loss, family members getting the virus, job losses, burnout, frontline workers, and an increase in gender-based violence, these numbers, in terms of the global figures of those with mental health, will increase. WHO estimates that approximately 1 billion persons suffer from mental health disease. In our part of the world, we're looking at 1 in 4 persons, and we expect that to increase. So in effect, as we work together to overcome the virus, let us also partner to improve the behavioral wellness of our children, parents, frontline workers, and family. And we must never forget, there's no health without mental health. So with that, I'll bring Dr. Hines to give you a brief summary of the epidemiology picture. Thank you.
Thank you, CMO, Honorable Prime Minister, Honorable Ministers, colleagues, members of the media, members of the viewing and listening public. Following on from the information provided by the CMO, from an epidemiologic perspective, what we're seeing at present is as follows. The initial downward trend that we've been seeing since about the 25th or so of August has continued. We have been seeing week-on-week decreases in the total number of new cases being diagnosed on a weekly basis. But what we have noted is that those decreases are slowing a little. So while we had a 35% decrease in the first week of downward trend, the next week was 22%. This last week has been 12%. So we're seeing that decrease, while we're still going downwards, that decrease is slowing. We're having what you would call a plateau. A plateau meaning we're sort of maintaining an even number of cases. Right now we're hovering in the 50s in terms of new cases reported on a daily basis. This, along with the rates that we're seeing of death in the population, staying around 1.7% of all those who are infected, is one of the things that we monitor and look at with regard to how well we're doing or not doing, and what the behavior of the population says in terms of what we are seeing with the figures. We're seeing that at this point, if the figures are stabilizing and not going down any further, that we've reached a sort of equilibrium point. People are doing certain things. Some people are following the instructions, others less so. And that reflects itself in the number of cases that we see on a daily basis. It's a point in time where we want to reflect and to point out that we would want to continue the adherence to these measures that we've been speaking about day in and day out. We want to continue to warn the individuals who have whatever pre-existing conditions, be it diabetes, hypertension, etc., not to take any respiratory illness for granted. We want to continue to encourage people who have any kind of respiratory symptoms to stay away from gatherings, including work. And this is because to the extent that we remove ill people from groups of susceptible people, we reduce the probability of individuals getting infected, and we reduce the speed at which this virus transmits itself through the population. So we've sort of flattened. We want to continue, keep up the work that we've been doing, and to do it a little better so that we can continue a downward trend. At that point, that's the point I really want to make with regard to the data. I'll turn you back over to the Prime Minister.
Thank you very much, Dr. Hines. I would like to ask the Minister to take a couple of minutes to share with us whatever perspective you may have.
Sure. Thank you, Honorable Prime Minister. So, ladies and gentlemen, the global scale of the pandemic, unfortunately, is showing little signs of slowing down. The average daily number of cases globally is still at a worrying 350,000 cases per day. That is not good. The total number of cases around the world stands at 37,318,270. The total number of deaths is still 1,075,409. Regionally, as reported today in the Express, Jamaica's total number of positive cases is now 7,363. They have recorded 4 more deaths. Their death toll now is 132. Suriname has passed 5,000 positive cases. Unfortunately, they are, I think, 5,004. every country around us is seeing increases. And in this context, what I would like, Prime Minister, if you would allow the CMO, if we don't get our caseload, which is, as Dr. Hines said, stuck at around 50 a day, correct? We anticipate at this level of infection, we are going to have 1 death per day if we don't get that significantly down. So our deaths are now 80, 90. If we don't get that figure of an average where we are plateauing at around 50 per day, it is predicted that we will have 1 death per day moving forward. We don't want to have that. We would like to get our caseload down so we could avoid more deaths. So that is a global scenario. Europe, United States, they are going into even more harsh lockdowns than what they had in the first phase. But in context, we are not doing too badly. We are not doing too badly, but we would like to be better. Not only in terms of the number of cases, but in terms of deaths. So we are asking the population, as we do more and more things, as I said in my budget debate yesterday, the equation is very simple. As we open up more, the public health measures also need to be adhered to more and more. Masking, social distancing, staying home if you are ill, and so on. So thank you very much, Prime Minister.
Thank you. Well, ladies and gentlemen, you will understand that we're pretty much we're very involved with the virus. We're in a pretty much, fortunately, a steady state in the last few days. We see some decline, but that is no reason for us to drop our guard, because to do that will be to end up like other persons who have anxiously anticipated that time when they could reduce their response, and there was only one outcome to that. In all the situations where people have decided that, well, it's time to go back to this or to go back to that or to go back to normal, you had situations where the level of infection rocketed upwards, and the countries or the cities or whoever they might be had to roll themselves back in, as the minister has said, to even harsher conditions in some situations. So what we're trying to do here in Trinidad and Tobago is to very slowly, thankfully, move back towards some semblance of normalcy without being too eager to do that, because that eagerness is what is going to cause the problem. I want to point out to the national community that when we were in the sporadic phase and we went into that period of lockdown, it prevented us from being overwhelmed by the ailments of the virus. But it was at a tremendous cost to the nation. That cost was borne by the taxpayers themselves through the state expenditure, by the private sector through the loss of production and business, and even people's savings were used up during that period. We have done very well as a small country, supporting our population in responding during a period of lockdown. But as head of the cabinet, I could tell you that a lot of what we did was based on borrowed money. We did not have a large amount of money that we applied to the response to the virus. What we did, we incurred significant debt and we paid support. Yesterday you would have heard Minister Cox give a comprehensive breakdown of the number of people who were supported by the taxpayer during that period. And you would have heard the Minister of Finance talk about how the Ministry of Finance went about accessing monies from the local banks, from whatever accounts we may have, and from the international agencies and so on. all of that was reported to the country. It was a huge amount of money that was required just to keep us going day to day during that period of that lockdown. In short, what I'm trying to say, let's go and do this and let's go and do that and risk another lockdown is to be cavalier. And I just want to say that if we end up in that situation again, where the medical, the environmental, the epidemiological response is that we have to lock down, like some countries are doing now, because whether they want to or not, having come out and done certain things, they are now forced to go back because that is the only reasonable thing to do, right? In the epidemic. We don't want to be in that situation because once you get into that situation, there's going to be that call again for that financial support. And unfortunately for Trinidad and Tobago, we do not have the wherewithal to fund another lockdown in that way. We funded it in that way up front as the foundation of our response. We now have to build on that foundation by not incurring that expense. And how do we do that? We do that by being very careful about how we use the space that we get. By virtue of the good response that we make to the virus, it gives us space to slow down the propagation of the virus. If we overdo it, we run the risk of needing to go back into a lockdown, and that is the last thing that we want. And that is why we have looked very closely at the numbers, the projections, and the models as to what is likely to happen if we do not very carefully manage our coming back out. You may recall, before we came back out of the lockdown, we had very low numbers. We had sporadic and some clusters, and we did very well. As we came back out, as there were more people out doing more things and being closer to one another and so on, not surprisingly, there was a spike. We went to the cluster phase, to the community spread, sorry. And we have been there. That's our designation now for quite some time. So we do know that if we come out to some semblance of normalcy, the exposure will give us a risk of a spiking of the virus. When the spike was very threatening, we took the measures we took a month ago. And so far, it has had the effect of suppressing the propagation of the virus in Trinidad and Tobago. We have to maintain that approach. But we understand that there are tremendous stresses and strains in the economy. We can't simply go on like this every week, every month, reporting these numbers and maintaining the kinds of economic and social activities that we're maintaining now. If we do that, there's a likelihood that we could, the economy itself could be damaged beyond repair in the short and medium term. So we have to be doing two things. We have to be cognizant of the threat of the virus. We also have to see what we can do while the virus is ravaging the national community in the way it has been. Fortunately, not like it has been in other areas where the effect has been more serious. So, after consultation with the medical experts, today we can make some adjustments, not coming out, not going back to normal, but adjustments that we can make which will allow us still to be wary of the spread of the virus, but we step forward a bit. So today, whereas before we were allowing gatherings of no more than 5 people, today we are going to permit gatherings of 10 people, no more than 10 people. That allows a little more activity. Funerals were limited to 10 people. We believe that in the discipline of funerals, one of the few places that we are almost guaranteed to have some discipline. And we think that we can allow 20 people to take part in a funeral. We have been very concerned about the effects of the current approaches on Tobago, where Tobago is so entirely dependent on a nature of activity. That activity, or should I say those activities by themselves, being the ones that are most detrimental, the kinds of activities. But we need to keep some life going in Tobago's economy, and we have agreed that there should be a bit more traffic between Trinidad and Tobago. Currently, there are only 2 flights per day, one in the morning and one in the afternoon. This has had the effect of stymieing a lot of economic activity and social activity in Tobago. We think that we can encourage CAL to run 6 flights a day to Tobago. And those flights, as you know, they are mandatory wearing of mask on board, and there's some spacing on, I think they're running at 50% per flight, staggering the seats in that way. So we can run 6 flights a day, which is the equivalent of 3 full flights, but 6 flights would give you more convenience in moving on, because if you miss the morning flight in Tobago, your next opportunity is the evening flight, and if you miss that, it's the next day. So we start with that. I must say, though, that I've been very disappointed with the reports I've been getting from the public service, where most of the reports have been that people have been abusing rather than cooperating. We, at this last adjustment, had indicated that the public service would be at 50%, meaning that only half of the public service will come out at any one day. And the way that that was going to operate was that you would rotate. You come one day, don't come the next day. Who didn't come on the first day, come on the second day, and so on. The reports are, by and large, that the very weak management has not taken charge of that situation, and that persons have been abusing it to the extent that where a department that should have 50 people end up with 8. Some people have not bothered to even come out. Some people have not bothered to see who come out, and it's like a general free-for-all. That is not what we intended. We expected greater responsibility, because what we have done, there are tens of thousands of public servants, and the government took the position to leave the private sector to be productive and full with their staff. But the government took the responsibility to pay full pay to staff, half of which would stay home, and the other half would come out. And of course, to be fair to the staff, not one set of people doing all the work all the time, so you rotate and come out. And that has not been happening, because people have just not been cooperating. But we still need to reduce the amount of people that are out there interacting. So there's still a need to not have the full public service out. So what do? We will continue to require a 50% rotation in the public service. And to do that, we will ask the head of the public service to instruct his immediate subordinates, meaning other PSs and his department, to ensure that a written roster is kept at all stations, all locations, and that public servants are required to rotate. People, you stay home on the day that you are rostered to stay home by your superior officer, and you come out on the day that you are rostered to come out. And in order to make sure that it is not left to be abused as it is being abused now, the head of the public service would be instructed by the competent authority to do this as an authorized action under law, and persons who do not turn up to work on the day when they are rostered to work are to be deemed to be absent from work, with the consequences that flow from that, including not being paid. So the support staff, those are the people who will be rotating like that. We expect that the management and heads of section staff would be out all the time to ensure that the public service functions. There's one public service department that normally, in a month, would handle, is it a month or a day? A day, 2,500 transactions. Is it a month? 2,500 2,500 transactions for the month. And this has been reduced down to 62. The last figure I saw was 62 for the month. The month before that, it was 100 and something. We just can't have that because the public service, as it says, is servicing the country. And if we allow that to happen, we are pretty much accidentally, surreptitiously, or unwittingly shutting down the public service with all kinds of consequences. We believe that our population should understand that what we are doing here, this response of being allowed to stay home and be paid, is not a joke. It is a serious response to a dangerous virus. And your responsibility is to stay home when you're required to stay and come out to work when you're required to come out. And in that way, we all would have the best opportunity to survive. Coming back to Tobago, we understand how the Tobago coastal economy works, and there's tremendous pressure on the people of Tobago who are not able to access the waterfront, particularly those who make a living from the coastline and the reef. So, and the same thing applies to the Caroni swamp, where people are allowed to go. Why we are not looking at the whole return to the beach for everybody, because going to the beach and bathing and so on, you can't wear a mask. And we have come to the conclusion over time that this wearing of a mask is so important that where it is not done, the exposure, the risk is much, much, much higher. And therefore, if the activity that you are to engage in, like swimming and partying on the beach and so on, without a mask, we can't have that. But what we could have is persons on a reef boat wearing a mask, or persons on a Caroni swamp boat wearing a mask. And as a result of that, we believe that in consultation with some of the people involved, we believe that we can start back some operations in these two areas by granting exemptions to Buccoo Reef tours and Caroni swamp tours. Those persons who are legitimately engaged in that, in whatever way you are engaged, you'll be granted an exemption so that this kind of business could begin. And we have looked very closely, I must say. I have been lobbied very firmly by distressed members of the clergy. And I won't say I understand everything that they've said to me. Going to church is important. Being in touch with your superior being is important. One pastor even gave me a long lecture as to how essential it is and where the word essential came from. But the epidemiology is that if we have gatherings in churches and singing and interactions, that is the environment in which we can end up with a result that we do not want, especially since the majority of people who usually partake in church services, well, not they're the only ones, but a large proportion of people who partake in those services are the most vulnerable people in the population. And we do not want to expose them and have a result that is unacceptable. So for a little while longer, as we anticipate a reduction in the concentration of the virus in the national population, for a little while longer, we believe that we should stay away from those activities. By a little while longer, I mean for another 2 weeks. And the same thing applies to bars and restaurants. It is our view that if there is no significant upward tick in our concentrations now, by the 24th of this month, we should be able to make the changes that would bring back activities into the two areas I just mentioned, churches and other places of worship, and we can do a bit more for bars and restaurants. And that being so, what you would have gathered from what I've said is that we are taking slow steps forward again, hoping that there will be a continuation of the cooperation of the national population with the protocols which seem to be working for us, which is to follow the hygiene protocols of sanitation, sanitizing, wear the mask, physical distancing, and do not congregate unnecessarily. And if we do that, we can make those steps, more and more steps. So hopefully by the end of the month, certainly by the 24th, which is 2 Saturdays from now, when I will join you again, and hopefully, if what we have managed to accomplish in the last month, which is to dull the spike and see a downturn in the numbers, then we should be able to add a bit more in these very these areas that I've mentioned where we are not yet going out are areas where people are making their livelihoods. We understand the difficulty, but a little bit longer, and as we do it, then it should be sustainable. If we overdo it now, trying to get more now, we might be choking by trying to swallow too much. We're not there yet, but we are going in the right direction. We're holding the line and going in the right direction, and we want to continue to do that. And I want to appeal to the national population to do what is asked of you in terms of cooperation. Yesterday and previous days I've been observing the people in and around the city of Port of Spain, I must say. I have seen a dramatic improvement in the number of people who are in fact complying with the mask wearing, and of course people exercising out. I see them spacing themselves out. I'm not seeing enough spacing in lines. I mean, maybe some of us have not been to England, but those of us who've been to England know how automatic it is, how lines form and lines work. But when you're in line, stay away from the person in front of you and let there be more spacing in lines. I've seen quite a few lines where people, they are in line, yes, but because they're anxious to get inside, and they defeat the purpose by being in line and being too close. And I've seen lots of children wearing masks, encouraged by their parents being out. I've seen people exercising and wearing masks. So we are slowly, effectively responding in the way that we are asked to respond. And as the results are positive, all I can say to you, let us continue. For those of you who are affected by the non-adjustment in your area, we are cognizant of the pain that you're feeling, and you're bearing the brunt of that. But hopefully, the behavior of the rest of us would have us in a position where very soon these restrictions can be removed, and all of us would be living with the virus with the same level of exposure and the same level of carrying the burden of the response. So before I ask for questions, I want to ask the Minister of National Security to give us an update as to how we are managing the repatriation of our citizens, particularly those who have been caught outside. And it is now 6 months, and we're trying to get as many people home as quickly as possible. Minister Young.
Thank you very much, Prime Minister, ministerial colleagues, Chief Medical Officer, medical personnel, members of the media, wider viewing and listening public of Trinidad and Tobago. Good afternoon. As you all are aware, we took a decision as one of the responses to this pandemic in March, and I think it was the 23rd of March, if I remember correctly, to shut the borders to both our nationals and to non-nationals. We had shut the borders to non-nationals a couple of weeks before that, and we've been managing the process. So if I can start off, first of all, by giving the statistics and the numbers of exemptions that have been granted over the period of time, and in particular within the last period of time when the Prime Minister announced that we would be doing more to repatriate on a quicker momentum. The total number of exemptions granted to enter Trinidad and Tobago as at the 6th of October is 5,284. So 5,284 exemptions granted to enter Trinidad and Tobago as at the 6th of October. The total number of exemptions granted to leave Trinidad and Tobago as at that same date, the 6th of October, 7,208. The exemptions granted to enter Trinidad and Tobago from August 31st to October 6th, so really over the period of the last month, we've managed to increase that number to 1,952. So in the last month, we've granted 1,952 exemptions as at the 6th of October, and we continue to be granting. The number of exemptions granted of persons departing Trinidad and Tobago during that same period, the 31st of August to the 6th of October, 977. What we've seen, as I was just explaining to the Prime Minister, is we've seen an increase in the number of applications being made to come home. And I'd just like to take a little bit of time to explain, out of this number that I've given of 5,284 persons who've been granted exemptions to come home, what has been happening. You all would remember within recent, the current policy is persons coming back from high risk and medium risk countries are required to go into 7 days of state supervised or state quarantine, and then the next 7 days, provided they don't indicate positive via test or that they don't require to be hospitalized, they're then allowed to go home and complete their next 7 days of quarantine. So it's a 14-day period, the first 7 days in state quarantine facilities or state supervised facilities, and then the next 7 days at home. That continues for high risk and medium risk countries. There are just a handful of low risk countries that when you come in from those countries, if you haven't been in a high or medium risk country for 14 days before that, you can go straight home and quarantine at home. What has happened is because of the recent spike in the numbers of cases, the facilities that were being used for state quarantine were then being utilized by the Ministry of Health for step-down facilities and to deal with our positive cases. Fortunately, we are now back in a position where those facilities are available to be used as state quarantine facilities. We've had the addition of UE St. Augustine campus. So we now have somewhere roughly a total of between 400 to 450 rooms available for us to utilize as state quarantine and state supervised quarantine facilities. What has happened since the Prime Minister announced that we were to repatriate on a quicker modality is we actually now have a fairly stable rotation taking place. Flights from the United States every 10 days, rotating between New York and Miami. We've also been running a number of flights through our state airline, Caribbean Airlines, from Barbados, where persons are making their way to Barbados and we're repatriating them back from Barbados. There have also been some flights from other countries like Jamaica and other countries where we've brought back persons. What we're now doing, fortunately, that we now have more facilities, is we are speeding that process up even more. So in this coming week, on Tuesday, we have a flight from, I believe the Tuesday flight is from from New York. Wednesday, we have a flight from Toronto. Friday, we have a flight from Barbados, and we're going to put on, within that 10-day period, a shorter period, another flight from the US, because we have now reached a stage with these increasing facilities we can use for state quarantine that we can bring back persons a lot quicker. What I would like to also spell out is we have the list of when people made applications. Our priority is to get back those persons who, unfortunately, due to this global pandemic, found themselves stuck out all over the world from March of this year. The addition of these people that we're seeing now applying are a lot of persons who have dual citizenship, persons who are living away and now want to return to be domiciled in Trinidad and Tobago. They are not the priority. The priority is those who went out on short trips or expected to come back prior to March or around March and are still stuck. Unfortunately, those numbers have dwindled. We have the statistics, we have the information at National Security, and they are the priority items, applying the same criteria, the old, the elderly, the sick, those with young children. But fortunately, we've seen that basket been reduced substantially. Now that we have these additional facilities, we will be able to grant more exemptions and also facilitate through the state airline from those jurisdictions that we've been able to send flights to bring persons back. So we expect this process to be speeded up. What I'd like the opportunity to just state, we are aware, because the information has been sent to me, that there are some mischief makers out there. And anyone who is telling persons that they have a way to facilitate a quicker grant of exemptions at the Ministry of National Security, that is simply not so. We are applying the criteria I've outlined before and today, those who were outside long before, who made their applications a while ago, and the old, the elderly, those with children, those who had children born outside, those are the priority and they are coming back. So anyone who is telling persons, join them, they have a way to get a quicker access, that is not so. As I've said before, taking us to court, the pre-action protocols, those matters are being defeated time and time again because the court recognizes that we have a proper criteria being applied and we will continue to apply that. And we are moving into another phase of speeding that up. We are going to be giving the instructions that those in the far-off jurisdictions, we still have some nationals in India, some in Japan, etc., they are going to be granted the exemptions. They'll make their way back and we will find ways to accommodate them to get in. So this is where we are now. Fortunately, we're moving and we're going to be speeding up the process and trying and getting more of our nationals back as quickly as possible. But with the priority being those who have been stuck outside for a lot longer periods, and we're going through that queue process to bring persons back. Also those who continue to use the mischief, because we are aware of it, of tricking, I'll use that word, persons that they have some way or they have chartered flights. That is simply not so. Continue to stick with the process. The process has speeded up. As we've seen, almost 2,000 in the last month repatriated to Trinidad and Tobago, and we will continue that process, Prime Minister.
Thank you. As we analyze our days and weeks ahead, there are 3 developments facing us in the coming weeks that we are cognizant of. One, next month we have Halloween. Is it this month? Yeah. Tell that to a Tobagonian, right? Yeah, you have to excuse me. I was not brought up with Halloween. But I represent Diego Martin West, so I learn as I go along. So we have Halloween where people get together to party and children get out in groups to have Halloween activity. We want to make sure that we are aware of what is happening there, and parents and children and communities are to be aware that these activities may need to be closely supervised and determined in such a way that they don't add to any threat that we are facing and they do not reverse any gain that we have made. After that, we have Diwali. That's another gathering event, and we are hoping that by the time these events come around, that our level would be so low that the risk would allow some kind of participation, but not participation that exposes us to a turnaround. But it's on the cards. I'm just putting it out there. And then, of course, we have Christmas. The worst Christmas that we can possibly have is a Christmas where we're being overwhelmed by COVID. And, of course, the Christmas season starts mid-November, where gatherings and expressions and partying and all that. But we are hoping that we can sacrifices we're making now will put us in a position that we can very cautiously acknowledge these 3 events without allowing these events to become seasons of spikes and turnarounds. So I just put that on the cards. And that's one of the reasons why we are working so hard and so committedly to bring the numbers down now so that we don't go into those seasons with high numbers and rapid community spread. Could we have questions now? If you have any questions, we'll take them now. And Minister Young, if you have questions to Minister Young, you will join us if you're called upon. Okay, so we start with Minister Young. Please put your questions.
We had mentioned of people tricking others into coming. Any investigations that those people?
Well, I mean, really, we're not going to waste resources having any investigations, right? I mean, we've had certain instances. Fortunately, Trinidadians are sensible people, and by now they would have seen that certain people are misleading them, and I dare say there's also a political spin and element in that on some of these group chats. We have had other instances where I believe there have been actions brought against persons. That is outside of the scope of the government, so we're not concerning ourselves with it. I just want people to be cautious. We had a bit of a scare about a month ago when information came to me that there were persons at the Ministry of National Security who were being bribed or selling that they could get exemptions. It fortunately turned out to be completely untrue. And what it was a private sector person charging people $1,500 US and telling them there was a way for them to get back in. And of course, there was no truth to that whatsoever. But at this stage, there's no need for any investigation.
Are there any breaches of the law with regards to these people tricking citizens?
Well, I mean, some of it is taking place outside of Trinidad and Tobago. It's not inside Trinidad and Tobago. If we see any instances of it, believe you me, we will take the necessary action and get the law enforcement authorities involved.
My last question for you is, do you have a number of the amount of requests we have for returning citizens?
As I say, what I've found is a very strange phenomenon. It is going up at times rather than going down, even though, as you've heard me say, we've brought home nearly 2,000 in the last month. So right now, the latest figure I got this afternoon of outstanding applications for persons to return to Trinidad and Tobago, 7,000, approximately 7,100. But what I can tell you, because we now categorize it, there are a lot of persons in there with dual, I don't have the breakdown, but with dual citizenship, other persons we're seeing, they say, look, they've lost their jobs, for example, pilots who were out in the Middle East flying for Etihad and UAE and some of these airlines, they now want to make their way back, persons in oil and gas, other persons in the United States who may have lost their jobs and they want to return to Trinidad and Tobago. Because you would remember at the start, it was a figure that was around that same figure, and we've brought back, as you've heard, over 5,000 people, and it's still there, so we continue to have those additions.
Now may be a good time for me to remind you that over and above those persons who were in transit and were caught outside by the sudden announcement of the border closure, persons who were normally domiciled in Trinidad and Tobago, over and above those persons, which are a few thousand, we have over 330,000 people outside in the United States mainly. I think there are 225,000 of them are in the United States, and another chunk, 75,000, are in the United Kingdom, who regard Trinidad and Tobago as home. So COVID or no COVID, you had this block of people who have access to claiming Trinidad and Tobago as home. And of course, you could imagine, as long as the borders are closed, and the borders are closed now and will remain closed for a little while longer, as long as the borders are closed and we are using this exemption system, this control system, and the control is only in place, control not for people moving, but for management of the virus and its population coming to us. As long as the borders are closed, there is going to be a stream of people wanting to come in and taxing the exemption system. So you could imagine, if that system is still in existence getting down to Christmas, I'm absolutely sure that there will be a large number of Trinidad and Tobago citizens who normally are outside, who would want to come home, if only for Christmas. They haven't seen their family for a long time. And in many instances as well, circumstances abroad are such that it's having a push effect on some of our citizens who normally would have been spending their time in countries outside of Trinidad and Tobago. Any country, not just one country. Where the numbers are larger, the expectation is that more persons from those areas will want to come to us. And then you have people in the Caribbean islands, people in the Middle East, people in South America, and we're expecting that as long as the borders are closed and we are having to grant exemptions until we have scheduled flights where people can handle their own stories themselves with airlines without government involvement, that you're going to have the management of this issue. Unfortunately, it's not all smooth sailing, because some people will see opportunities there either for misbehavior, political mischief, or just impatience. It's one of the outcomes of the pandemic management, but as long as we are here now, that's going to be the norm for a little while longer. We are hoping that the first break that's going to happen in this situation is when we are able to begin cautiously to have scheduled flights. But we can't have that right now because we are still, as a matter of policy, maintaining control through quarantine, both state control and home quarantine. As long as that is still our response in the country, we have to do some control as to how many we can take in at once, how many facilities we have, and as Minister Young just pointed out, because we have not had a big pressure on the hospital system requiring the step down and so on, we have more room available for the quarantining of transients. And therefore, it's improving, but it's going to be with us for a little while longer. But I'm hoping that by the time we get to the Christmas situation, we would have broken the back of it, especially for those who were just caught inadvertently. And then we'd only be dealing with those who want to come home. And we will then be able to allow many more people to come home and to be with their families, at least for Diwali and Christmas and so on as we go forward.
Because Minister Young, one of my questions now would have been, we're seeing the control of flights, but we're not opening back up borders. And that's another question that persons wanting to know, how soon can we get flights going? But with that control now in place.
Well, as you've seen, and there has been an increase and an uptick in the number of flights. So whereas before we had a clamoring, you all would have recalled, for example, students who wanted to get back to school being one of the groups that were saying they needed flights. You're not hearing that conversation anymore. And in fact, we're seeing it in the numbers, as you would have seen when I just said you have 2,000 coming in as compared to 977 leaving. So those have provided. So for example, we had foreign governments at one time asking us for permission for flights for their nationals to go. And I'll use Canada as an example. They told us this week there was no longer a need for them to put those flights on because our flight next week their nationals can get on. And as the Prime Minister said, and as he's instructed, we are now trying to schedule these in accordance with the room that we have in facilities. Unfortunately, we have more room, and I'd like to take the opportunity to thank the Ministry of Health personnel and also those in national security who have been carrying this load. Part of the additional facilities we have now available, Prime Minister, as well, are from University of the West Indies. We're using both day bay, and they've now given us, and it's available, some almost 200 plus rooms at St. Augustine. So that helps us tremendously, and we are going to make the most use of it. Thank you.
About trying to get it down to about 50 cases per day, and you're saying that if we continue with the numbers that we are currently at, that you're going to anticipate 1 death per day moving forward, just to make sure that I have it clear. We're currently looking at, let's say, an average of 1 or 2 deaths per day with the current numbers that we have. It paints a sort of bleak picture for us going forward. So in terms of where we are now, if we're anticipating that at 50 cases per day, we're looking at 1 death per day. Our cases now are averaging 70s, 80s. We're not getting up as high as 90s or 100 anymore. But how bleak? What is our overall picture now or standing? If we're going to, I'm not putting it across properly.
Take it in.
One question.
Here.
While you gather your thoughts, let me just add to what I think you're putting your finger on, pulse on.
Because where we're at 50, right? We're almost double, if not double that. And we're looking at 2 deaths per day, or even 3 deaths sometimes per day. No.
Right. So the CMO.
Maybe you might be able to clarify for
Yeah, sure.
Yeah.
So we're very close. If you take today and look at the 7-day average, we are actually 52 just below 53. So we have been hovering in around 50, and that's how Minister was able to calculate based on the 1.72% death rate that we have been seeing for the last. And that is taking into effect everything that we had, all the cases. So that death rate, based on the number of 50 per day over the recent past, gives us approximately 1 death per day thereabouts. So if we continue at that level, that's what we can expect. We are hoping that the numbers go down, and as the numbers go down, if the same sort of demography of people are affected and the death rate stays the same, 1.72%, you can expect a decrease in death as well. But it all depends on what category of person gets infected. If we see, for instance, a shift where we have a high-risk category or elderly population becoming infected, of course the death rate will go up. So we want to keep that population, the vulnerable ones, safe as long as we can, and get those numbers down on a daily basis so that we can actually have a consequential drop in the number of deaths as well.
But this might be a good time for me to add. When I discussed this particular problem that you raised with the health department, the question came up and the answer was that as we hear every day in the report that some person or two would have deceased, and they usually is a rider that they had comorbidities, underlying health conditions along with COVID, one easily gets the impression that these are elderly people who were sick, very vulnerable. They were in the system, and they would have been suffering for a while, being cared for a while, and eventually they would have expired. So I asked the doctors, is that true? Because that was the impression that one could get hearing about these comorbidities every day, and some person might have passed away. Turns out that is not only the very vulnerable group, that there are, and there has been, younger people who got sick, came in, and passed away in a short order. And that is something that ought to be known to the population. This is not just something, COVID is not about picking off our senior citizens who had underlying health conditions and eventually succumb. We have had a number of instances of people who did not fit into that category, who were infected and did not make it. I don't know how many, but I was a little concerned to have heard that we did have instances like that, because quite a number of younger people and healthier people who are involved in physical activity and so on believe that you are not exposed to the risk, but we all are. And in my own research, I've seen where abroad, a number of instances where persons got infected, young people, and within a matter of a week, some people had died, others had fought for 2 to 3 months, people in their 40s, late 30s, and eventually they were overcome, especially persons who did not know that they might have had some underlying health condition.
Yeah, so the CMO will have a better handle on that. So that's a good technical question. So the CMO.
Yeah, so out of the 90, we had, I think, about 5 persons would have died outside the hospital so far. That's the figure that I have coming to me.
And that would have been home persons who came into treatment and were isolated.
Not necessarily. Different scenarios, persons that would have been at home and passed away while at home. I don't want to go into the individual details. It's just a handful of people, but different scenarios. And again, we want to make sure even the ones that have been diagnosed COVID positive and you are at home, once you find your symptoms escalate, as we have said before, any sort of shortness of breath, extreme fatigue, vomiting, diarrhea, those kinds of things, you try to get into a facility as quickly as you can. As you know, we have the monitoring and evaluation going on from the CMOH offices, which happens twice a day. We got in our additional 4,000 pulse oximeters a couple of days ago, and that should be distributed to the remaining patients that would not have gotten the low-risk ones. So hopefully by early next week, every household that has a positive case will also have a pulse oximeter, which is a very useful clinical tool to basically tell how you're going in terms of respiratory function. It tells your oxygen level as well as your pulse. So every household that has a positive case will be able to have one of those by next week.
Who will be paying for this device?
The device was bought by the Ministry of Health, the state.
And the cost of it?
Approximately $150, if I remember right. Don't hold me to the figure, but it's approximately $150. SpO2 machine, yes, it's a pulse oximeter.
Thank you, Prime Minister. As frequently happens as you announce certain easing of restrictions, we get a barrage of questions. So this one, as the Prime Minister announced, moving from public gatherings of 5 to 10, the regulations with respect to team sports and contact sports remain in place. All right, so it is not going to affect the team sports and the contact sports. For the next 14 days, we ask that people continue to refrain from that. This is really for the groups and of persons in public, not for the playing of team sports. So the regulations with respect to team sports and contact sports will remain and are prohibited.
Prime Minister could or should answer this one. In terms of regional travel, I know we were looking at getting our numbers down so it's not in part of a bubble.
Maybe I should take that one. Yeah, you by now, as a person in the media and taking part in these proceedings, you would know where we are with our circumstances. CARICOM is still operating in some semblance of a sharing of space, but the challenges have not gone away. Some new challenges have occurred within the bubble. The intention was that we'd all try to be at the same level of infection and control, so our populations would not be at any additional risk by mixing. We have not got to that yet because it's pretty much an oscillation. And some countries, the smaller territories, have always had smaller exposure and smaller responses, fortunately. They still remain among the least, numerically, the least infected. The bigger territories are the ones that are still struggling. You compare Jamaica, Trinidad and Tobago. Barbados is struggling to hold their numbers down, but they had a bit of an upsurge recently. Suriname and Guyana still have challenges very much like ours. So we have not yet all come down to the designated number of 10 per day, 20 per day. That is still a little way off.
200,000.
Right? 20 per day per 100,000. So, no. 20 per 100,000. Yeah. So that's the target we had set. In a 2-week period, you need to be in that sort of level. We are outside of that, and most of our Caribbean colleagues. However, we are hopeful that if our populations are well managed and they are cooperative, that we, by and large, could get down to lower numbers. But where we are not able to respond appropriately, it is to be expected that the numbers could get larger.
Minister, CMO, I have several questions for health, and I have some questions for the Prime Minister as well. So I'll start with the health.
You don't have much time left. We've been here for an hour and a half, so you're probably running out of time. So get your questions to me quickly. I may not have an answer for you, but let's get them.
All right, for the Prime Minister, 2 of them non-COVID related. I'll ask them one after the other. One is the call from the opposition leader for salary cut and also the tax exemptions for MPs to be removed. In response to that, and also the EU has placed TNT on a watch list. Again, in response to those 2 things.
Well, what is the question or the opposition leader? That is the one that I will not take. I will respond to the opposition leader in the parliament, in the same place where she's made the call. I have the parliament floor too, and I will respond there. What's the EU story? I'm not familiar with what that.
Some sort of not tax, fraud, I believe it was, that we were placed on a list, a blacklist.
I couldn't respond to that because I don't know what you're talking about.
Issued a statement yesterday. It was the 9th, right?
I'm not familiar with that, so I wouldn't want to hazard a response. If it comes up, we will respond appropriately. But as of now, I do not have that information. Sometimes, sometimes these things have a way of recycling, and they come up as though they came up recently. It might.
On this year, we had an issue that
we always have EU stories coming to us, and it's part of the daily operation. The EU makes measurements and takes decisions. In fact, one of the objections that CARICOM has made, if you followed CARICOM prime ministers at the UN last month. All of us spoke at the UN, including Trinidad and Tobago. And one of the issues we raised was the arbitrary way in which developed countries unilaterally take decisions that can affect us very seriously, especially with respect to our economy and our financial situation. And that's, we raised that as a matter of serious concern. I mean, I myself led a delegation to Washington to complain and to explain our circumstance where these decisions are made about who's blacklisting whom and who's withdrawing correspondent banking and de-risking our banks and so on. And in the case of the EU, labeling us as, what do you call it, offshore money laundering dens and so on. These are just par for the course how they treat us, small countries, but we do talk back and cover ourselves in the international regulations.
You mentioned the issue of abuse of the system by public servants, and that now steps are being taken, concrete steps are being taken to ensure that there is a proper roster system in place, and that persons abusing the system could face consequences. What's going to happen? Is there anything that has been done so far to determine those persons before who might have been?
I couldn't tell you more than I've said. It was just that we expect a certain amount of cooperation in a simple, straightforward system. But we being who we are, there are many people who take advantage of it. And very many people who think that we are on one glorified holiday, especially getting paid to be home. Sometimes you get the impression that some people don't even want to go back to work. That is not unusual in the human endeavor, but we can't run the country like that. Those who are required to be at work, and especially since we are rotating the workload, we expect the cooperation. But I can't tell you any more now. And I'm not here belaboring the point or attacking any particular person or group of persons. We never had a system in place to deal with this or to manage this kind of thing. This COVID has brought us into the market square without a lot of the goods to be sold there. And therefore, we are learning as we go along. And I'm just raising it so that enough citizens could feel sufficiently responsible to cooperate. And we're saying that if you don't cooperate, well, then there are other things that would have to happen.
On that same note, Prime Minister, did the government speak with the PSA with regards to all the issues that were raised today?
That's a general question that I can't respond to now. I'm not aware that the government has spoken to the PSA, but the government has its responsibility and the PSA has theirs. And of course, we expect that where there's cooperation, there'll be progress. Where there's no cooperation, well, then the progress could be in danger. But there are certain people in the government, the CPO, the minister, and so on, that they would talk to the PSA. But the members of the PSA are what the government is concerned about, and not so much anything else. The PSA are government workers, and they service the country, and the government has a responsibility to ensure that the decisions made are the best options available to the people of Trinidad and Tobago.
Health Minister, we can now go to Buccoo Reef and to Caroni Swamp. Snorkeling and deep sea diving allowed at Nyland Pool?
Not at this time. It's limited to reef tours and Caroni Swamp tours, as far as I'm aware.
No.
Okay.
Yesterday you made mention of a 9.4, I think it is, million vaccine.
9.7, yes.
$9.7 million vaccine. You also made mention of storage facility being constructed or to be constructed. Do you have any estimate as to the cost of this facility?
No, so we are now in the planning stages. We are now figuring out sizes and so on, and then we go out to get estimates and so on.
In the story I read, I saw two figures being quoted, totaling 362,000 vaccine being bought for that 9.7 million. Is that the total figure or that the first batch?
Okay, no, so let me explain. The COVAX, these vaccines are being sourced under something called the COVAX facility. COVAX facility is a funding mechanism that works together with WHO, CEPI, and Gavi, Global Vaccine Alliance. What it is meant to do is to have equitable access to vaccines for all countries, regardless of income status. What they are trying to avoid are for rich countries, especially when the vaccines are manufactured, to hoard the vaccines for their own populations. So it is going to work on an equitable basis. Once any country signs on to COVAX, as we have, you are guaranteed in the first instance to get vaccine doses to inoculate 20% of your population. So we have 1.4 million people. We will therefore get enough vaccines to inoculate 280,000 persons. That 20% applies to any country, regardless of income status or size. That is the equity built in, right? The goal of COVAX is to produce 2 billion vaccines by the end of 2021 to vaccinate that approximate 20% of about 7 billion people. That's the world population, right? After that first phase, what Cabinet signed on to is a total vaccination purchase to cover 33% of the population, which is roughly about 462,000 persons. So we will get 280 in the first instance under the position of equity, and then the difference will come in afterwards, where we hope to vaccinate 33% of the population. Right? Yeah. And in the first instance, under the under the COVAX protocols, that 20%, I want to use the word reserved, but the people to get first call on vaccines will be healthcare workers, immunocompromised, elderly.
Any consideration? I know it's now it's new to make this vaccine mandatory.
Mandatory? That is something we'll have to discuss, but it's highly recommended, just like the flu vaccine. It's difficult to make that mandatory, but it's highly recommended.
Now, when I say mandatory, I know in schools you need to have your
Yeah.
that type of thing.
So that is something we'll have to look at legislatively.
If there are no further...
One last question. I think it was the CMO that made mention of mental health. Have we seen an increase in mental health cases during this COVID period?
I don't have the exact figures with me, but anecdotally, I think yes. There have been, of course, rises in certain illnesses. So yes, but we can have a look at. We are having a look at it actually now, especially after the week has gone with Mental Health Week. I will get back to my director and see if we can get those figures out to you.
And if I can make one last plea, go out and get your flu vaccines, please, please, please. Flu vaccines are available free of charge. Elderly, healthcare workers, immunocompromised, children between 6 months and 5 years. 6 months and 5 years. Go and get your flu vaccines.
You have another question? This is the last one, okay.
So some car workers were messaging and wanted to find out if they would be compensated for the 3 months that they have been sent home.
Some who?
Car workers.
I'm sure Cal explained very clearly what the situation is. Cal was very, very clear in what the situation is with respect to its employees. Thank you very much.